质子治疗是最近癌症治疗最新的利器，它本身呢可以精准的治疗癌症，同时可以把周围的正常组织保护起来。那因为这样子的关系，所以可以增加治愈率，而且可以减少副作用。那所以呢，它在癌症治疗的适应症方面呢，不管从脑瘤、鼻咽癌、肺癌、乳癌、肝癌，或是摄入腺癌等等，都是有非常好的疗效。而且最重要的是儿童癌症，因为小孩子在发育过程当中呢，除了要把癌症治好之外呢，对于组织的修复还有组织的保护非常的重要，因为会影响到他们的未来的生育的发展。那另外一个很重要的是，中国医药大学附设医院的质子中心呢，是全世界最先进的治疗的机器，也是中部地区唯一的一台质子治疗的设备。那我们的团队也是非常的有国际的经验跟这个训练，所以呢可以提供各位病友呢还有家属们呢，如果有需要可以咨询，还有适当的情形呢也可以做治疗。
Hi, my name is Cliff Chow. I am the Director of the Proton Center at China Medical University of Taichung, Taiwan. Today, I'm going to talk about clinical application of proton therapy, which is the most advanced cancer treatment in the world. First, let me introduce myself. I'm a board-certified radiation oncologist, both in Taiwan and in the United States. I first trained in Taiwan, but later on did the research in Japan and then went on to United States, working at Washington University and later on become a professor at MD Anderson Cancer Center. And later on, I moved on to New York and become the chairman and professor of Columbia University and Cornell University. A few years back, I returned to Taiwan, become the Cancer Center Director of China Medical University Healthcare System, which is one of the best and biggest healthcare system in Taiwan. And now I'm working on a proton center, which is the most advanced technology to cure cancer. I received multiple awards, including published more than 200 peer-reviewed papers and also 4 textbooks, and received award from North America Radiological Society a few years back. Let me introduce the different type of radiation first. Radiation can be divided by X-ray, which is commonly used for diagnostic use and therapeutic. Some of the most commonly heard IMRTs, radiosurgery, those are the X-ray can penetrate the body and can only be stopped by lead or a thick concrete. And some of the treatments with the different directions we call gamma ray radiation that we use in gamma knife for the brain disease. Proton therapy is one of the newest and the latest. It's a charged particle can penetrate through and kill tumor cells, but when it stops, they release all the energy, and so that it would not penetrate through the body. There's a big difference between conventional X-ray and proton therapy. China Medical University have the new campus and where the Proton Center is located. In the picture, you can see the beautiful architect, and it's well designed and the most cutting-edge technology, and I welcome everybody to visit. Proton therapy in a way that look like this. On this picture, on the right-hand side, you can see the regular X-ray. It can penetrate the body first. Before hitting the tumor, it also releases the energy into the body. Regular X-ray, after hitting the tumor, also continue on, travel through the body, and then also deposit the radiation that damage to the rest of the tissue. On the other hand, proton therapy, they enter the body is very low dose, similar to this curve. But when it hit the tumor, it releases energy. This phenomenon called Bragg's peak is a well-renowned physicist from London and discovered this kind of philosophy. This principle actually can apply to the medical treatment. On the right lower corner, you can see, and the regular X-ray can hit the tumor, but also penetrates to the body. On the other hand, the proton therapy, once it hit the tumor, and they stop. And we take advantage of this, as I shown in this illustration. Liver cancer is very common in Asian population because of the hepatitis, chronic hepatitis. If you have a tumor in the center, you can imagine in conventional X-ray treatment, as shown on the right-hand side of this picture, the only way can concentrate the radiation to the tumor, you need to go through all different directions. As such, some of the low dose area would be entered into the normal tissue. But if you use a proton therapy, they can select it, enter the body, and hit the tumor and stop. And this phenomenon can save a lot of life. For example, most of people with the hepatoma, with the liver cancer, their liver already been damaged by previous hepatitis inflammation. So saving some radiation doses to the normal liver is very important. This become life and death issue. The similar treatment can also apply to the brain tumor. For example, glioblastoma is one of the most notorious tumor in the brain and very difficult to kill. If you received the most advanced conventional treatment we call IMRT, and still, although you can treat it, the tumor, but normal tissue can also receive radiation. And on the right-hand side, you can see the proton therapy. It can hit the tumor and stop. But people can say, this a little bit here and there, what's the difference? The difference is you can see the normal tissue receive certain amount of radiation that can affect the future recovery and also neurological function. Head and neck cancer is one of the most common ones in Asia. It can be from nasopharynx, we call nasopharyngeal carcinoma, or arising from the oral cavity, oropharynx, it can call oropharyngeal carcinoma. And oropharyngeal carcinoma and nasopharyngeal carcinoma is the best to be treated with the proton therapy for the reason that they can concentrate the radiation to the tumor, but can save surrounding tissue including salivary gland, which will affect the treatment afterward. Most of the people treated conventional radiation treatment, they're going to have a dry mouth and many other issues. The study have shown that radiation treatments compared with the proton therapy and photon therapy is a proton therapy in a way that is more advanced and more advantageous. This is a publication from United States, from MD Anderson, and from the showing that the advanced treatment with the proton therapy indeed is more advantageous. Another proton therapy advantage will be for the breast cancer, especially for women with the left breast cancer. These people are saying, why left side? You can see from this picture, the left breast actually sitting above and right next to the heart. And on the left-hand side, you can see we can exactly treat the left breast cancer indeed, no problem with the conventional treatment called IMRT. But you can see that those crowds spread into the heart. And when you use the proton therapy, it can clearly that spare the left side of the heart. And that part of the heart actually contained very important coronary artery. This coronary artery later on will certainly, if you treat a proton therapy later on, the chance of having coronary artery disease will be much less. So that would be worth considering for those women unfortunately having left breast cancer. Another important thing is that the treating lung cancer. Lung cancer actually commonly spread to not only in the lung area, but it can also spread to the middle part of the lung. It's called a lymph node. And this lymph node can travel in the middle part of the heart, and then also can go to the neck. As shown in this picture, you can see on the right-hand side, the tumor, when it's treated with conventional treatment, and a lot of lung tissues going to be damaged. But on the other hand, if you treat the proton on the left-hand side of the picture, you can see that very clearly it can save a lot of healthy lung tissue. Proton therapy also good for a very difficult treatment in modern medical era, which is pancreatic cancer. Pancreatic cancer reside in the middle of the abdomen. It's right next to the small intestine, bowel, kidneys, and livers, and others, stomach, many critical structure. Of course, if early diagnosis enough, surgery is one of the best treatment options, but unfortunately, most of the patients, when you get diagnosed, already beyond the stage, commonly unresectable or may require certain treatments to reduce the tumor size before surgery can be done. And if you treat it with the conventional treatment as shown on the left side of the panel, because of the spreading of the dose to the normal tissue, the radiation dose to the pancreatic cancer is limited. But if you treat it with the right-hand side of proton beam, you can see that sparing of the bowel surrounding tissue is very clearly can be done. That means radiation dose can be higher and the treatment response will be better. So this is a clear advantage of treating pancreatic cancer with the proton beam. China Medical University Proton Center, as shown in this picture, designed by well-renowned architect, and we have designed it in a way that look like a piece of art. We truly welcome you to visit. In here, we equipped with most modern technology called Variant ProBeam 360. 360 means that this radiation proton beam can rotating through the 360 degree. You can select any treatment angle from different directions. As this can be precisely positioned in a millimeter precision. And most importantly, when patients on the treatment table, we have the computer tomography we call cone beam CT that can be performed. This cone beam CT will capture the exact location of the patient's position and the tumor location, because proton is very precise. So precision is very important. For example, if a patient eating too much food and bowel can be extended, or some of the water in the bladder, and then it can display the tumor. So it's very important every day on the treatment position that patient need to be imaged on the table. This is very important. That's the most advanced technology that we have at China Medical University. And this technology can show in many different diseases. For example, pediatric cancer is one example. On the right-hand side, you can see that commonly there's a disease called medulloblastoma in the children. They usually will spread from the brain all the way down along the spinal canal. When we treat this kinds of pediatric patients, children, the radiation delivered will penetrate through the spinal cord and into the bone in front of it. And what happened to this kinds of situation? Those children, when survive the cancer, they usually would have growth retardation, means that they cannot grow big and their bone structure will be distorted, and then they will not have the normal healthy adulthood later on. But if you treat with a proton beam, they treat the cancer and stop, and so that their bone structure can be spared. But this is very important, the tool that can be done. That will get to the next question, so what kinds of disease will be best for the proton therapy? As shown in this picture, and also some of the examples that I have shown to you, from the brain tumor to the head and neck cancer, to the lung, to the breast, to the liver, to the pancreas, and also to the prostate cancer. There are many clinical outcome studies have shown that proton indeed is better than a conventional radiation treatment. They're worth considering if you have a need. In terms of the cost, Taiwan is most advanced technology with well-trained personnel and the very friendly environment. In the same type of treatment, our cost is about 1/4 that of US, about 1/2 of that of in UK. And so that it's worth for you to consider should you or your family need radiation treatment, and proton therapy is one of the best options to consider. Thank you very much for listening.